I'm sitting here one day after my second hip replacement. I had my left hip replaced in May of '09. Doctor did a great job with that, but the procedure was different then than the procedure the Dr. DeCook uses. My recovery from the other procedure went well, no infection, no problems at all, just took a longer time. And there were a lot of precautions that I had under that procedure 2 years ago. I couldn't cross my legs, I couldn't stoop, couldn't drive for quite a while. Just things that took a good bit of time for everything to heal back because it was a pretty invasive procedure. I remember when I was trying to decide this time when it was time to go ahead and do it, and I was talking with Dr. DeCook. He said, "Do you feel like an old man yet?" I said, "Well, I feel like a young man with an old man's hip." And he said, "Well, it's time, it's time to get it replaced." There's really not much comparison between what I feel right now a day after the procedure yesterday and what I felt like probably even a few weeks after the other procedure. And again, no reflection on the surgeon's difference in the procedure. That's the big difference. Had the surgery yesterday, I think my last pain pill was yesterday sometime, and as I'm sitting here right now, I don't even have what I'd call discomfort. The pain is zero. The warnings that I had before, that the things I couldn't do, like crossing the feet and all that, precautions they call them, I don't have those now. Dr. DeCook said I could drive when I was comfortable with it, which may not be on the way home, but it won't be long after that. The advice they've given me is that my body will tell me what not to do, and I'll certainly try to be attentive to that and not be doing something that common sense would tell me not to do. I could have waited a few more months and maybe got to where I was having more difficulty getting around, or I could have waited till I just had no choice and couldn't even function. But I was to the point where I was not doing a lot of things day to day that I like to do. I live out in the country, have a tractor and grass to mow and peace trees to look after, just things to do, and I'm finding myself less and less able to do those things. So that's always a decision folks have to make. Well, when is it time, to do something like this if you're going to have to do it? And usually the doctors will say, you'll know when it's time. I would absolutely recommend this procedure to anyone that's considering a hip replacement.